Thanks, Sarah. Yeah, Geraint, two things for me that I'm wondering if you can shed some light on. One is trying to do the maths on a system that, as I understand it, the franchise model would be attractive because it would provide the sort of back office functionality that smaller providers are having to disproportionately invest in. And so it would be a cheaper, a more attractive proposition for them to buy into a franchise where those services are provided. That sounds like all the financial benefits would be to those smaller providers, and I'm really struggling to see where 50 million a year is going to ever come from in a model which is, sort of enticing people in on the grounds that we'll do stuff for you and it'll be cheaper for you. Having said that, maybe with standardized systems across Wales, with a more flexible workforce, with a more locally deployed workforce, possibly. I mean, I just don't get the equations, and that's my fault for not having read the report in detail. But are you still a bit mystified as to where 50 million might be realised, even if it is across the system and from all parties?
Yeah, I think, like I said, in my view it's pretty optimistic, but actually we spend an awful lot of money on social care and older people services. So 50 million sounds loads of money, but actually you could get to a point where that builds up quite quickly. Their view is, the shared service option, particularly with technology. Technology is expensive to research and expensive to invest in. It's getting easier because it's now much easier to have a sort of year-on-year revenue approach to modernising versus large capital investment of the years gone by. So as technologies evolve to cloud-based, subscription-based solutions, it lets you take the Netflix approach of modernising an organisation, which is sort of revenue in year-on-year based. Whereas
so that's the sort of technologies you're thinking about, rather than assistive technologies being increasingly deployed for care purposes.
Yeah, so that's the sort of franchise model they're talking about. Definitely focuses more on shared services than it does in actual delivery for individuals. That being said, the franchise could be a mechanism to access sort of shared service for that technology. But to be fair, the space does quite well in that. The telecare approach has been regionalised in lots of areas, and actually delivering that is much better now than it's been in years gone by. So I don't know how much efficiency there is. There's also opportunity with, and I don't remember seeing this in the report heavily, but there's lots of local authorities really doubling down on investing in training and technology that reduces the need for double-handed calls with manual handling equipment. And you could see a franchise model being able to sort of reap the benefits of that in a much more consistent way across Wales, and even possibly recruiting central health professionals to help that be coordinated, from the provider end, not just from the health and social care side of social care commissioning. So I think there's opportunities there. The 50 million is sort of, I think it's a bit finger in the air, but I'm not sure how you do it any other way, given the sort of how fractured the market is and how the hourly rates vary so much across Wales. Because that's the other thing the report touches on is, I think they land at an hourly rate of like £30 for social care and older people services. I think they land on £30.40 after breaking down all the costs, and that's on last year's living wage before it's just gone up. And I can tell you, no, that is a step away from most hourly rates across Wales for that service. So it's an interesting flag, I suppose, to say actually, even when we look at this stuff together and work out what social care should be costing, the actual funding is not meeting what the franchise model would need to make it work even then. So it's a little bit sort of finger in the air, but it's I'm not sure where else you'd start with trying to cover the market in that way. So
yeah, and it is difficult. I suppose the other question that I'm really interested in is there any scope within this to remove profit by degrees. For it to happen in a natural way. People who are making profit out of social care would be quite resistant, I think, to this model. So is there any anticipation of the kind of counterproductive things that could happen if you were to introduce a franchising model? I mean, we've seen with removing of profit from children's services, the kind of behaviours that then the markets will, I say the markets, trying to be kind. It's people who make profit out of children's care are very keen to find ways to throw a spanner in the works, aren't they? And I should imagine the same would be true of this model. And I suppose the bit of, I don't want to hog you, so I'm going to get off in a minute. The other bit that really intrigues me is, I know Cartrefi is looking at how you make care more effective by having much more local patch-based delivery. I think the travel time and the cost of travel for domiciliary care is a massive element of the equation. And I think that system, which could deliver much more locally based care for carers to be delivering in their own patch to people that are close by them, and it'd be both more sustainable from a climate point of view and also, in my view, probably much more cost effective. But it would require some rethinking about the transportation model for domiciliary care, which currently is entirely dependent on people on a pittance of a wage being able to afford to run a really uneconomic and probably very environmentally unfriendly vehicle and park on pavements in overcrowded streets in areas of social deprivation. I mean, that whole transport, how you take that awful dependency on the car by people who can't afford to run cars, and if they can afford to run a car, they're not making any money at all out of their job because they're having to spend it all on running a car. I think that's just such a horrible chicken and egg situation. I'd love to know what, if anything, this franchising model proposes around transportation.
They're two great points. So I'll do them in reverse. I'll do the last point first. The transport sort of isn't really in fact, the model of delivery isn't really up for change in that report in any major way that I've picked up on. But you could definitely see that a franchise vehicle being used as a way to sort of do some of that across Wales in a coordinated way. And you're right, the transport, it's kind of the model's challenge in that as the demand on the service has gone up, you can generally bucket when people need their support, and so they're built around grounds. I'm sure I'm going to explain the model to everyone, but it is very much wasteful in time and transport. And when you think about before people had cars and were doing home help, you kind of had social care staff based in that very patch-based way, and they might be working across 4 or 5 streets in a rural area, and they'd walk and they'd start somewhere, and then they'd pop over the road to see somebody else for a bit, and they'd be back and forth, and there wasn't any of this sort of micromanaging of staff doing particular tasks on a list and only them tasks as a way to sort of control cost, which is kind of where we're at. There's a perception in the system that's needed in order to control cost, but actually the end result is probably the reverse. In terms of the profit in older people's services, there's a heavy element in residential services as well. I mean, we've marketized the social care space, and I think, although my personal view is it would be great for us not to be making profit in social care, I think that's we're down this road that's going to be very, very hard to reverse out of quickly, and I think it's a long-term thing, particularly where because there's private provision's got a bit of a badge to it at the minute, especially with everything in the press. But to be fair, there's some really well-run, good quality private provision out there that's doing really good by people and making it work, and particularly there's North Wales, for instance, there's lots of sort of small family enterprises on the go there that both the citizens are really content with and really happy with, and and is delivering a good service. So I think we just need to be a little bit careful in a sort of mandatory no profit at all in a market that's 80% supported by profit-making organisations. You know, you could really destabilise it, as you flagged, really quickly by enforcing that. And there needs to be a much more gentle approach. And there may be organisations that are tempted to convert and become sort of not-for-profits or cooperatives, you know, or worker cooperatives even. That might be, you know, so you still build in an element of profit in there, but it's returned to the workforce in a dividend or something. You know, that could be really interesting as well in that space. But it's a tough situation, and it's really complex. So
thanks,
Thank
John.
you, Geraint.
I was wondering similar things. In Monmouthshire we have our micro carers, who are not height challenged, but people who are self-employed, perhaps even for part-time during the week, and providing care for one or a few clients. I'm wondering whether this platform would, could potentially provide an expansion of that, and that very localized. And I can also see an opportunity for a sort of standard model of worker co-op. But I'm going to pass over to Jackie now. Sorry, and come back on all of those things.
Thanks, Sarah. Yeah, lovely. Thank you. Good talk. And obviously, I've not read the papers, so now I'm going to go away and definitely read that paper. I've also got procurement background as well as in my nursing sort of point of view. And I'm just wondering, when you say like the franchisor, is that going through some sort of procurement? Do we know who's going to run it? So is that in the paper anywhere, or? Well, the question I had really.
Yeah, they talk about the options. It could be a local authority, it could be a not-for-profit, or it could be but they don't, because it's like a feasibility study. They talk about next steps, and you know, if there was an appetite to do this, then it would probably kick into stage 2.
Because a lot of the things that we're talking about, Geraint, is we could be included in that tendering. So, you know, what is it we want to get out now? Like you were just saying about whether it's a third party, you know, or private, you can score that, can't you? Know what I mean? And the social value that it's going to bring. So all that is in the new procurement rules, as we know, but certainly in the services that we're doing. So I'm just thinking, you know, that's probably another area that we need to make sure if there's something that they're asking for that we're actually putting into, well, especially people like you know, and Mary, I suppose, you know, whoever's kind of got that level of being involved, that they're actually making sure that procurement tendering side, that we're including the things that we really want, because that's key, isn't it? If you don't get your specs right and you don't ask for your scoring, then you won't get but I think you're right. I think we should be encouraging private sector to be going down the route of at least their workers being in cooperatives and, you know, involved users. That's even better, isn't it?
Yeah,
it's very interesting. Lots of good stuff, I think, but we've got to make sure we don't take the foot off the pedal here and be encouraging. I mean, personally, nationalisation is where I'd be coming from, but I'm also cooperated too. So obviously we know that's not going to happen at the moment. So I would definitely push for the not-for-profit. So thank you.
And the tricky bit with it all, I think, is because they talk about in the report, they reference that they wouldn't prevent organisations being profit making and making a profit, but also competing. And that's an interesting complexity to it all, is that actually there's 22 local authorities commissioning individually. And so even when there is a franchise model right at the top, there's no guarantee or expectation that they will be gifted work or spot contracted, that they're all going to have to go through that procurement process across the 22 local authorities, which will result with franchisee competing against franchisee, potentially, which you kind of just, I don't know what that's fixing then. You might be doubling down on the marketplace and ramping up the pressure, unless there was some franchise agreement that you had a non-competing clause in there. which is another complication to, I don't know how you'd sort of go about
But
having that
some
sort
of the things you do though in procurement side of things is the market engagement, isn't it? So you're going out and having conversations to kind of get, well, what's out there hopefully, but what you might be missing also you need to look for. But on the back of that, you could be saying your specifications are going to be something of this nature, and what can you do to bring yourself up to them specs, which is where we're coming from with this.
Yeah.
It's just another way of thinking it through and promoting what we really want, you know what I mean? So
I'm a trustee of a charity, a disability charity in Harrow, and have been well for over a decade. It was set up about 50 years ago. It's one of these charities that is run by disabled people, and it provides services largely for the disabled community, both in terms of physical disabilities, which I come under the heading of, neurodivergent. We have a very interesting autistic group, and learning disabilities. We provide a range of training. I think about 10 years ago, we had contracts for about $500,000 to provide services for Harrow Council, and over a period of time we've seen that disappear, and we've had to look at other ways of running. I think our current turnover is sort of approaching about $500,000. But certainly finances is of particular importance. If you're non-for-profit, you really do have to be not for loss as well. I mean, you have to balance the books. I sent the report to our chief exec, who's, well, I think she's brilliant. She and has been chief exec on and off for probably about 20 years of our charity. And she sent me back a couple of sentences, which probably reflect my own view. It says, interesting, the franchise idea. I think all government services should be run by social enterprises. Incidentally, the public sector is a disaster, and funding issues aside, it is not workable that the monitoring and service provision in both done effectively by the state. But also not sure that giving taxpayers' money to private business is workable either. I'm not quite sure I 100% agree with that comment, but anyway, she says, I've often thought if the state took a strong monitoring role and stepped aside from providing services, but gave them to the non-for-profit sector, we would have a flourishing set of services. My own experience, seen this a few times, is that probably the best example is somebody who was our next door neighbour at Harrow. He was getting on. His wife sadly had died. He lived in quite a large house on his own, and he was well liked locally. He lived there for over 50 years. And his church used to come and help him do the shopping. We and one, two of others neighbours would make sure that he was okay. And then he had an assessment for his care needs, and everything seemed to move away from the local volunteers and into a more professional setting. I don't know what the care is. The care company that provided it was. I'm sure they did an excellent job, but it's always seemed to me, for a long time, I thought that one of the assessments ought to be around whether an individual has an immediate family that could provide some level of care, or an extended family, or an extended community. And this never seems to be part of the equation. Reading the report, I kind of felt that there was an open door to actually develop this idea. What do you think? Yeah,
it's interesting. You're right. I think, whenever whenever we're looking at providing paid services for people to maintain independence and live in communities, it should definitely be professional paid support last. You know, and you go through a hierarchical of options. What can the community offer? What are the assets? What are the, you know, and what can relationships give you, and whether that's family or friends or just community, the community around you. The bit that we're you know, and I think we've got an underestimated reliance on that already. And I think it's interesting the amount of people that are waiting for carers assessments in Wales paints a picture of we've got loads of people doing that already that aren't being recognised or supported or assessed or gaining an assessment to get them the right support for that to be sustainable. So I think you're right that we absolutely should be using that as an approach, but that shouldn't be free either. There's a responsibility to unpaid carers and to networks and communities and all the things, the services and communities that let people lean into them to defer or negate the need for paid care support. Need to be seen in that light. That is actually their investments in community and people in order to delay or defer larger spending down the line. But it feels like we're a step away from joining the dots there. I think there is recognition in the system that it needs to be valued and it needs to be important, but there just doesn't feel like there's enough capacity, particularly in the care assessment area, for people to have a fair crack at that. So, but you're right. I think it's super important.
Yeah, and of course, access to care assessed and provided by local authorities and care providers is only a very small part of it. I mean, there's a lot of people who, you know, pay for what they need and contract with whoever to provide any support that the family isn't able to.
Yeah.
Often outside those kind of structures or in addition to those structures. So I'm not clear how this would support that whole network.